I'm not saying that there's a direct correlation. What I'm saying is that there's not an easy answer. That I think it demands a careful deliberation. And
what is a meth lab incident?
I think how you calculate a meth lab incident is somewhat varied depending on the institution that tracks the information, but it could be as simple as a trailer. The old time, when we used to think of the old ways of making meth, of the large operations in a large trailer in the middle of nowhere, that would be an incident. It can also be the 2-liter bottle in a car. So there's a very...
That's fine. I just didn't know it. I read that before and other stuff, and I didn't really know what it meant.
And just like with any type of technology with a stop sale system, it's identifying a lot more incidents, and it's identifying, you're having the ability to identify the purchasers.
Jim, what would you, I look here at the states with the reductions greater than 90%, Arizona on down through Idaho.
Sure.
Washington has the NPlex system. Oregon has the prescription mandate. None of these other states have anything. What's the word on the street as to what they're doing to reduce it with absolutely nothing in place?
No, I think if you look at California, for example, is under consideration for the NPlex system. Some pharmacies may currently utilize tracking. Some places will utilize it. It may not be the NPlex system statewide. There may be a county, or there may be a pharmacy chain that may utilize an internal system that talks to each other. What I've seen, and from what I have seen from these states in particular, is that there was a large influx of Mexican methamphetamine coming in, that there was a large drug bust of Mexican methamphetamine in production in this region. So I think that there's a lot of circumstances. I don't think there's one simple thing that you can point to that. But again, like I mentioned, what we have is a very complex issue, and again, both sides clearly want to eliminate illegal meth. I guess there's no such thing as legal meth, but I think we all want to eliminate the illegal drug use. You know, there is a cost to taxpayers. Currently, over-the-counter medication is set at a sales tax. Prescription medications are not subject to sales tax. So we calculated based on sales last year, and this was part of the fiscal note that was in the Missouri State House bill, that there's an impact of around $1 million to the net sales tax on an annual basis. It's just something to consider, that revenues like this would be removed. And then there's obviously, like I mentioned, there is that cost to the healthcare system, whether it's the physician shortage, whether it's impacting medically underserved areas. Just this last week, I believe it was Post-Dispatch mentioned that there's a pharmacy shortage, and the St. Louis School of Pharmacy is increasing their enrollment to 1,200 to impact the increase in to impact the perceived decrease in pharmacists. And as I mentioned, you know, the blocking cell system works, and happy to answer any questions. I think, you know, we're very much willing to see the same outcome.
When this got put behind the counter to begin with, what did that take to get that off the shelves that you could buy it where it's behind the pharmacy, behind the counter? How did they get to that? I don't remember.
Yeah, I'm gonna talk, and not being a specific part of this issue, I believe it was about 5 years ago, maybe even more than that, when it went behind the counter. I guess kind of going backwards, and my years might be off, so please don't hold me to my years. You know, currently, we've got the NPlex system, there's electronic tracking. A couple of years ago, there was a spiral-bound notebook that you could walk into a Schnucks, and I did this, and you'd sign your name, and I'd lose my Sudafed, or I'd leave it at my office, and I went back to the same store or a different one. There was a very minimal tracking system, and they didn't talk to each other. Prior to that, I believe it was the Eliminate Meth Act, and I believe it was Senator Talent who was a part of this back in the early 2000s. Took Pseudoephedrine from on the shelf to behind the counter, which, believe me, when Drixoral didn't stop making Drixoral, that was the worst thing that happened to me. So it's been in the 2000s, and I know I'm just not very good with those exact years, but it's been a gradual process from taking it from off the shelves to behind the counter to finally implementing the tracking system. And I know that our industry is working with state legislators to look at some legislation for this next session about what some of the options are. And that's something that they hope to deliberate down at the State House this winter.
That's probably gonna pop back up next the statewide.
Oh, sure.
What it was kind of like the fee that we talk about for 911 using cell phones. It's one of those annual things that goes in,
It does.
into the
Or
House.
local control for law enforcement in St. Louis. So
Right.
yeah, it's gonna. Although that's got a special section.
Right, right. So, back to this map. Am I assuming correctly that everybody else on the map is less than a 90% reduction?
It says include.
Oh no, no. The map what you're looking at are the two dark ones.
Right?
The two very dark ones are the two states in the United States, the only two
Right.
states that have prescription-only model, statewide. The darker gray, not the black, the very dark gray, including Missouri, that color, and in addition, Michigan, have the NPlex system. The shaded grays do not have anything on the statewide system.
What type of reduction numbers are we seeing in the states with the MPLEX system?
In the states with the NPlex system, it's a block system. So what we're seeing in Missouri, for example, I can't speak to the other states, but we're seeing in Missouri, we haven't tracked, the NPlex system has not tracked the sales, since it's only been operational since January 1. But what we're seeing is a block of 5,000 sales per month or more. And then and the data from those western states, again, there's those western states that had decreases. And I don't have it in front of me, but I can get you very, very shortly. I believe it's Alabama has seen similar reductions to Mississippi, or Mississippi's seen similar reductions to, Mississippi has the, you never tell Mississippi and Alabama apart. Mississippi has it, Alabama does not, and they're both seeing similar reductions.
I'll tell you what, on that note, go down to Alabama and say, am I in Alabama or Mississippi? And they'll tell you which
They will certainly tell me. And
do it in a football game. They'll straighten you out right away.
you know what? I'm gonna be at the Missouri game on Saturday, and I'm not gonna make the same mistake when I go anywhere near Kansas City to cross State Line Road and say that they're on a J line.
There you go. That's bad. That's a bad practice to get into.
There might be a fairly large number of states that's reduced to more than 90%.
I think that's something that I have to look at state by state. I would say that the western states where I've specifically looked at, there's a large number that have seen that reduction. And I would say that in the states where we've seen influx, we're seeing the blocking. And now that we're having more states that are implementing this, where the states can talk to each other, you can't buy your legal limit in Missouri and cross the river and go into Illinois because the two systems track each other. You can't go into Arkansas to Tennessee because the two systems tracking each other. You can go from Arkansas into Mississippi, and it is Mississippi because I remember driving across the border from Arkansas to Mississippi, the old Miss gang. You can drive across the border from Arkansas to Mississippi and get a prescription, and the two systems aren't talking to each other.
Now, didn't Tennessee just overtake Missouri as the
I believe so, and
dubious honor of being the most
I believe so.
meth-infested state?
Yeah, not to make light of it, Missouri is still up there. I mean, there is still a problem.
Were there just that many more users, or?
I think the technology, and I know a couple weeks ago you had the meeting in the evening, and I believe Sergeant Groner.
Right.
I think he would agree, or I think everybody agrees, that the technology is going away from the large manufacturing facilities of illicit drugs. The technology is now, pardon my French, the idiot with the 2-liter bottle.
Mm-hmm.
I think that is why you're seeing this, in my opinion, I think that is leading to a significant spike in the number of incidents. Because instead of a large operation, there are still large operations. I mean, the one that was busted out in the western states was a huge operation. And the majority of methamphetamine is coming in from Mexico, and Mexico has banned pseudoephedrine since 2007.
Mm-hmm.
Yet they're still getting it in there.
And we're not really, well, the law enforcement, if they bust somebody with methamphetamine, maybe this is not something, but can you tell whether it's Mexican methamphetamine or whether it's
I would not
homemade?
even want to guess on that one. I would say if they're making it, it's obviously not. I mean, not to make light of the question. I mean, I think if there's if it's in the production stage, it's obviously domestic. If it's in the final stage, I would have to assume that there's no way of telling, but there may be animal law enforcement be the ones that would know that. I think it would be incumbent upon tracing back where the supply chain came from. But I'm not sure if you can from just purely the product.
Right. How many cold allergy remedies do the companies that you represent, how many cold and allergy remedies do they put out that don't contain pseudoephedrine?
That don't? I know there's 16 that do. I think there are, I couldn't even begin to guess the number, whether it's 2 or 2 million of that do not contain pseudoephedrine. But for a large segment of the population, pseudoephedrine is one of those things that definitely works for them.
Right. There's a large segment of the population that marijuana works for painkiller as well, though.
Fortunately, this is not that discussion.
Yeah. Right. Just an observation.
I would think it would be very difficult or impossible to argue that the NPLEX system's not good, that it's, you know, effective. So I think the bottom line question you hear quite a bit is that going far enough for the people who would favor prescription? Can a lot more be done into helping to lessen the meth problem with prescriptions?
Yeah. You know, I think it goes back to we all want the same end, and I think that's where at the State House we're having those preliminary deliberations with our industry to figure out what can be done from our perspective and to work with the legislators down in the state. I think when you go from over-the-counter to prescription and you blind yourself to the ability to see what's happening in real time, I think you put yourself, any institution or any state puts themselves at a disadvantage.
So this NPLEX system is just implemented in January 1st of this year?
It went fully online January 1 of this year. It was passed, if I get my dates correct, it would have been passed during the 2010 session. It would have been fully implemented, it began implementation in September of 2010. And it became fully statewide. There's a time for probably the local independent pharmacies to give them a chance to get all this stuff integrated. And then January 1 it became the law.
Walmart and Walgreens were a little behind the curve getting, for obvious reasons, they didn't come online until January, correct? Some of the smaller ones, I think, were jumped right in.
I can't answer that. I know that's why they had the grace period, whether it's a Walmart or whether it's Jerry's Pharmacy at 47 and you know, right there by the gas station or whatever it happens to be. I think they put that grace period in with any kind of new technology
Right.
to give them the ability to come online.
Do you gentlemen have anything else for these guys?
The HIPAA laws, so there's a difference as far as whether it's the NPLEX or whether it's prescription state.
Mm-hmm.
That's an idea I hadn't heard presented before.
Yeah, it is. A HIPAA law being federal limits the ability of any non-healthcare provider. I mean, when you go to your doctor, you have to sign a HIPAA designation for my wife to do whatever. And with HIPAA laws, you cannot in real time allow law enforcement to look in. It requires